We've all been there, reaching for a document, grabbing a book only to recoil in sharp, stinging pain. The culprit? A seemingly innocuous paper cut. These tiny terrors, barely visible to the eye, inflict a level of pain disproportionate to their size. But why? What makes this everyday annoyance such a potent, pain-inducing machine? Under a microscope, paper reveals its true nature, a jagged landscape of wood fibers ready to wreak havoc on unsuspecting fingertips. Our fingertips are densely populated with nociceptors, our body's dedicated pain receptors. So, the next time you find yourself nursing a throbbing paper cut, remember this. You're witnessing a fascinating interplay of biology and physics. Our fingertips are incredibly sensitive, and that's not by accident. They're our primary tools for interacting with the world, constantly touching, feeling, and manipulating objects. This heightened sensitivity is due to the sheer density of nociceptors packed into this small area. Imagine a symphony orchestra, each instrument representing a nociceptor. A gentle touch might elicit a soft whisper from a lone flute, but introduce a sharp, jagged edge like that of a piece of paper, and you unleash a cacophony of sound. Our fingertips lack a protective layer of fat and muscle, leaving our nociceptors vulnerable and exposed. Pain, as unpleasant as it is our body's way of saying, pay attention, something is wrong. We often think of paper as smooth and harmless, a stark contrast to the sharp edges of knives or scissors. We handle paper every day, from books to office documents, without a second thought. But this perception couldn't be further from the truth. Paper, in reality, hides a dangerous secret. Under a microscope, the edge of a seemingly innocuous sheet of paper transforms into a menacing saw blade. Its edges a chaotic landscape of jagged, microscopic fibers. These fibers are not just random, they are intricately woven and incredibly sharp. These fibers, derived from wood pulp, are the building blocks of paper. The process of turning wood into paper involves breaking down the wood into these tiny, sharp fragments. When you run your finger across a piece of paper, it's like dragging your skin across a miniature forest of tiny, serrated blades. Each fiber is ready to slice into your skin. Unlike a clean cut from a sharp blade, which severs cleanly through tissue, a paper cut is far more insidious. A paper cut tears and shreds its way through the skin, creating a wider wound with more surface area. This jagged tear is what makes paper cuts so uniquely painful. This increased surface area means more exposed nerve endings and ultimately more pain. The nerves are left raw and exposed, amplifying the sensation. The jagged edges of a paper cut make it difficult for the wound to close properly, often leading to prolonged discomfort, delaying the healing process and prolonging the agony. So next time you handle a piece of paper, remember the microscopic menace it hides. Adding insult to injury, paper cuts, despite their superficial nature, are notoriously slow to heal. These tiny yet excruciatingly painful cuts can be a real nuisance. The very factors that make them so painful, their jagged edges and shallow depth, also contribute to their prolonged healing time. Unlike clean cuts from a knife, paper cuts create a more complex wound. A shallow cut, while less severe on the surface, often fails to trigger the body's full arsenal of healing mechanisms. This means the body doesn't respond as aggressively as it would to a deeper wound. Paper cuts often bleed very little, depriving them of this natural healing boost. The lack of blood flow means fewer clotting agents and healing cells reach the site. Their shallow depth leaves the exposed nerve endings vulnerable to the elements. This exposure is what makes them so sensitive and painful. Everyday activities like washing dishes or even just flexing your hand can cause the cut to reopen, further delaying the healing process. This constant reopening prevents the formation of a proper scab. It's a cruel irony. The very things that make paper cuts seem so insignificant are the very things that contribute to their prolonged pain and slow healing. So next time you get a paper cut, remember it's not as trivial as it seems. While the pain of a paper cut might seem like an unavoidable form of torture, it doesn't have to ruin your day. There are steps you can take to mitigate the agony and speed up the healing process, ensuring you get back to your routine quickly. First and foremost, resist the urge to pull your hand away dramatically while sucking in air through clenched teeth. This only heightens the pain. Instead, gently cleanse the cut with cool water and mild soap. This simple step is crucial. This helps remove any foreign particles and reduces the risk of infection, which is essential for proper healing. Next, apply gentle pressure to stop any bleeding. This might take a few moments, so be patient. Once the bleeding has subsided, apply an antibiotic ointment to keep the wound moist and prevent infection. This step is vital for a quick recovery. Finally, cover the cut with a bandage to protect it from further irritation and to keep it clean. With a little TLC and these simple steps, you can emerge victorious from this everyday battle of man versus paper, feeling relieved and ready to tackle the rest of your day.